Hello, everyone. Thank you for logging in and joining us today. I see all of our participants joining, and we're going to get started here in just a moment. So thank you again for joining us as part of this HealthLinks webinar series. Today's conversation, Health at Work, is about supporting workers with chronic health conditions, and we're excited for today's conversation. All right, I'm going to go ahead and get started. It's nice to see so many people joining us on Zoom today. Again, today's conversation, Health at Work, supporting workers with chronic health conditions. And this is our final workshop or event for 2023. We've had 6 webinars, and we've really appreciated all of you participating throughout the year. We're building our 2024 calendar and releasing that very soon. And so we're excited to continue this series, and the amount of enthusiasm and participation we've gotten has just been tremendous. A little bit about me and our program. My name is David Shapiro. I'm the Senior Manager for Programs and Partnerships at the Center for Health, Work, and Environment. We are at the Colorado School of Public Health and one of 10 centers of excellence for total worker health funded by NIOSH, the National Institute for Occupational Safety and Health at the CDC. I am a white male in my mid to late 40s. Today, I'm wearing a light blue button-down shirt, and I'm wearing my hair in dark brown is short and curly. I have gray rimmed glasses on, and I have clean shaven. My Zoom background is the HealthLinks logo, inner looping with black and white coloring. A few housekeeping items before we get started. Everyone on the webinar is kept on mute throughout the duration of the presentation. And if you have a question for myself or any of the presenters, please use the Q&A section on your toolbar. That way, if you have a colleague or an associate that has the same question as you, they can use the thumbs up feature to vote on that question rather than to retype it. That helps us sort of manage the Q&A section. We'd love for you to use the chat right now. Tell us where you're joining us from. It's so great to see almost all 50 states in the US represented, as well as so many countries internationally. So the chat will be used for you to tell us where you're from, but also if you have any technical issues, the chat will be where you can post those concerns. But once again, please use the question and answer part of the toolbar for questions for our speakers and panelists. This webinar will be recorded, and you will receive the recording of it. For those of you that are claiming continuing education credits, we know how important the CHES credits are for our certified health educators. There will be, or should be, a survey that pops up at the end of today's webinar. We need you to complete that survey in order to access those credits. And we will have a link to the survey available in the chat, as well as in our follow-up email. And finally, if you need closed captions, those are available on your Zoom toolbar as well. We always start with a land acknowledgement, which I'll read now. As we gather in this virtual space, we honor and acknowledge that the University of Colorado's 4 campuses are on the traditional territories and ancestral homelands of the Cheyenne, Arapaho, Ute, Apache, Comanche, Kiowa, Lakota, Pueblo, and Shoshone nations. Further, we acknowledge the 48 contemporary tribal lands historically tied to the lands that comprise what is now called Colorado. Acknowledging that we live in the homelands of indigenous peoples recognizes the original stewards of these lands and their legacies. With this land acknowledgement, we celebrate the many contributions of Native peoples to the fields of medicine, mathematics, government and military service, arts, literature, engineering, and more. We also recognize the sophisticated and intricate knowledge systems Indigenous peoples have developed in relationship to their lands. We recognize and affirm the ties these nations have to their traditional homelands and the many Indigenous people who thrive in this place alive and strong. We also acknowledge the painful history of ill treatment and forced removal that has had a profoundly negative impact on Native nations. We respect the many diverse Indigenous peoples still connected to this land. We honor them and thank the Indigenous ancestors of this place. The University of Colorado pledges to provide educational opportunities for Native students, faculty, and staff, and advance our mission to understand the history and contemporary lives of Native peoples. So the agenda for today, we're going to start with setting the stage, a sort of macro look at stressors at work and how they contribute to chronic health conditions. We'll then move into a speaker discussion with a few of our representatives from industry and from the business community. And then we will have a question and answer section as well. And our goal is to help you define and understand how chronic conditions affect and impact your workers and the people you work with, as well as its impact on your medical plan, to help you build a plan to support workers with chronic health conditions, and also have evidence-based tools to support workers who are experiencing chronic health conditions. Our keynote presenter is Dr. Peter Schnall. Peter is an emeritus professor at the University of California, Irvine. Dr. Schnall received his training as a medical doctor from Stanford University and completed a medical residency at AECOM, as well as a 3-year NIH LBI fellowship to study epidemiology at the Columbia School of Public Health. For 40 years, Dr. Schnall has conducted research into the causes of essential hypertension, and now Dr. Schnall is the co-director of the Healthy Work campaign to share with the public our understanding of chronic illnesses' social causes, including work factors. Just going to transition over to your presentation now, Peter. Peter, if you'd like to introduce yourself, I'm just trying to pull up my Zoom toolbar.
That's fine. Hi, everybody. Welcome. Delighted to be here to share some of the ideas and research findings that have been accumulating in the field of occupational health and epidemiology over the last 30, 40 years. Good. So you missed the title bar. There it is, work stressors and illness. And a little bit of reference to our Healthy Work campaign if we have time at the end of the presentation. I'm very grateful and appreciative of being invited to be here today. Next slide, David. And I just, you know, in all due respect, you can't be hearing me present without all of the effort and time and energy and research and work that's been done by all of my colleagues who are part of the team of the Healthy Work campaign, including my co-director, Marty Dobson. Next slide, please. And next, stop it. Okay, back. Okay, so as way of introduction, something I think everybody in the audience almost surely knows, people are having more difficulty at work and they are complaining of stress more and more frequently at higher and higher percentages. And some surveys are reporting people reporting exhaustion and some aspects of burnout. They're not exactly the same condition, as you know, but 72% is not an unusual survey result, particularly among occupational health workers, doctors, nurses, etc. And this has been getting worse. COVID obviously has complicated matters and made the workplace even more stressful. But even before COVID and even after COVID, the level of stress is very high. Next slide, please. Did we skip over something?
I don't think so.
No? Okay. So some work stressors that people should be familiar with that have received a great deal of documentation. This is not a complete list of all of the important work stressors, but these are the ones which have the strongest findings associated with them. And from left to right, we have job strain, high effort, low reward, which is effort reward imbalance. We have work-life imbalance, long work hours, and various things that go on at the workplace, including harassment, discrimination, and bullying, as major stressors that are impacting on people's health. Next slide, please. So why are work stressors increasing, and why are people complaining of more and more stress? Working conditions in the United States are changing substantially, and unfortunately, in many regards, they're becoming more and more negative. Not on this list, because I can't call it a specific stressor, is the whole concept of lean production, which is basically the idea of trying to make production as efficient as possible and to limit wasted time and thereby increase productivity. So many businesses in America have adopted lean production as their mode of operation. And in addition to changing work in terms of lean production, we have many people now doing what we call precarious labor, uncontracted labor. There are some 25 to 30% of American workers who are now classified as being in the precarious labor category. That's 165 million people. So we're talking about something on the order of 50 million people who are now in what we call precarious jobs. Also, people are working longer hours. Blue-collar workers who are protected by contracts. This may not be the case because they're limited by law to 40 hours, but many low-wage workers have no contracts that basically protect them in terms of long hours, and they are working overtime and on difficult schedules. And then we have increasing psychosocial stressors. To some extent, we include long work hours as a psychosocial stressor, but I mentioned the others above. And all of these are contributing to increasing symptomatology. Next slide, David. So you probably all remember our characters on the left, on the production line. And the key thing about that film, of course, is that the production line went so fast that the pies fell off the edge. There is an increasing body of evidence, okay, that the way work is organized is a major risk factor for burnout and depression, as well as contributor to musculoskeletal disorders, hypertension, and CVD. And also we can add acute injuries and chronic injuries leading to arthritic outcomes. And then there are things that affect productivity, such as sickness absence, presenteeism, disability, absence from work, et cetera, et cetera. Next slide, please. So here's a breakdown of what we know from many years of research as to the causes of 3 of the major conditions associated with, we believe, with work. One is CVD, the other is high blood pressure, and the third is burnout and depression. And you look and notice the commonality of the stressors. And one of the things we want to try and understand is how these things interact with each other to produce these varying outcomes. They're not so varying, okay? It turns out that burnout and depression, which result from work psychosocial stressors and long hours and exhaustion, is a risk factor for cardiovascular disease. People who have high blood pressure also have associations with some of these conditions. So next slide. Next. And next. Okay, one more. Good. So here's a model of what we think is going on. We see on the left-hand side the psychosocial stressors that I just presented in the previous slides, sources of stress at work. They contribute to behaviors, smoking, a compensatory action. When people are stressed or fatigued, they smoke. Nicotine is a stimulant, and it is something that fights fatigue. Then we have at work, long work days characterized by sedentary behavior, lack of exercise. And we all know how many people leave work and have to have a drink, or they have to have a lot of drinks, okay, and get into problems with heavy alcohol use. Next, go back just one second, David, let me finish that. Okay, so those risk factors contribute to hypertension and obesity. So these individual behaviors, okay, are contributors to things like high blood pressure and to weight gain. And they sometimes are contributors to burnout and depression. We see as consequences of stress also sleeping problems, problems with heart rate and variability, and then we get atherosclerosis developing, and that leads on to cardiovascular disease. Next slide. We have increasing evidence that long work hours increases heart disease risk. Going from 0 hours of overtime to 3 to 4 hours of overtime is associated with an almost 50% increased risk for heart disease. Next slide, please. And then we can talk about other aspects of work that people don't oftentimes think of as psychosocial stressors. But for example, threat avoidant vigilant work. I don't know how many of you have heard this term before, but it's extremely important. People who drive or operate vehicles, okay, are under continuous stress. Bus drivers, for example, when you enter a bus and you get behind the wheel of a vehicle, you immediately need to be vigilant as to the circumstances around the bus. You drive the bus, you have to avoid vehicles, you have to avoid accidents. You can't brake the bus quickly because you'll knock the riders to the floor. You can't experience even a momentary lack of attention or make a single wrong decision. If we put ambulatory blood pressure monitors onto the arms of drivers, whether they're bus drivers, taxi cab drivers, airplane pilots, you name them, okay, you will see that as they come to work and enter the work environment and step up into the bus, their blood pressure will go up from 5 to 10 millimeters. And it's only the development of ambulatory blood pressure monitoring in the last 25 years that it's made it possible to detect the fact that people are responding to these work environments with these evidence of biological arousal. Next slide, please. So most studies of professional drivers show increased risks of cardiovascular disease and hypertension. And as I mentioned, urban transit operators are an example. There's been extensive studies done in Europe, in Sweden, showing that drivers of buses have 3 times the increased risk of heart disease compared to men in other jobs. Similarly, in Denmark, and also research in San Francisco. When you enter the work environment in these occupations, your blood pressure goes up almost immediately. When they climb the stairs into the bus, their blood pressures go up by 10 millimeters. Next slide. So one of the risk factors that has gotten the most attention, and I would imagine most of you interested enough in this presentation will be aware of job strain, work that's high in demands and low in control. And I'm going to come back to that because I want to describe some of my own research on job strain. But if you are exposed to job strain, most studies will show significant results between having job strain and outcomes, either to cardiovascular disease or psychological disorders, and even to musculoskeletal disorders. Next slide. And Australia has a major study showing that some 15% of depression is related to job strain. And men and women who have job strain are more likely to have disability and lose time from work because of their conditions. Next slide, please. Next slide. Okay, go back one slide, David. I'm sorry. Oh, no, sorry. Go ahead. No, sorry. Next one. No, I changed the order around since I talked to you. So I want to talk for a few minutes about high blood pressure. Some of you may know about some of my work. I've published a lot on hypertension, including papers about the etiology of hypertension from a social perspective. What I want you to take away from this is that high blood pressure and hypertension in modern society, they're new diseases that have emerged with industrial production. Our ancestors, our neighbors in Sweden/Bern agricultural communities or agricultural communities and hunter-gatherers, anthropologists went out and studied them for decades and could not find any evidence of high blood pressure among any of these groups of people. And even in the United States, where high blood pressure is prevalent, extremely prevalent, some of you may be surprised to know that by the age of 70% of the population has high blood pressure, which has been incorrectly attributable to aging. And it's not due to aging because we can find groups of people, fairly large populations, even inside of the United States, whose blood pressures are normal at age 70. It is not a disease of aging. It's a disease of chronic stress. And it has been increasing in prevalence, not only in industrial nations, but as all of our neighboring countries undergo transformation to industrial societies, they go from having prevalences of almost 0 to numbers that are starting to approach what we see in the Western industrial countries. So high blood pressure has now been demonstrated to be related to demands, loss of control or lack of control, this threat avoidant vigilance, long work hours, bullying, job insecurity, social class, poverty, and crowding. So it's not terribly surprising that by the age of 60 or 50, 50% or more of the population in the United States has high blood pressure, because we're all being chronically exposed to living conditions which cause us to have biological arousal. Next slide, David. So I want to just talk about some of the research I did when I was beginning epidemiology many years ago at Cornell Medical Center. Next slide. It began as a case, you can go one more. One more. Okay, stop. Thank you, David. We began with a case control study, which was completed in the year 2000, which found that if you were exposed to job strain among a group of about 300 working men, you were about 3 times more likely to have high blood pressure. And we did this using ambulatory blood pressure as one of the outcome measures. And we then followed these people every 3 years, doing repeated measures of ambulatory blood pressure and repeated measures of their job strain status. So what was an initial case control study became a prospective study, and it then became a longitudinal study, and we ended up with 472 subjects at 10 different sites, including 40% women. Next slide. So here's some initial interesting results. If you have your ambulatory blood pressure measured at either the first wave of the study or the second wave, your systolic blood pressure will be roughly, I'm sorry, that's a little hard to see, but on top of that, the red bar is 7.8 and then 6.4. At both waves, the people who had job strain were basically 7 millimeters of blood pressure higher and 5 millimeters higher in terms of their diastolic. And this is controlling for most of the known risk factors for high blood pressure. Next slide. Next. And then this is a most interesting slide. That's why this is included here. This slide basically shows you how people do at both time 1 and time 2 in terms of their job strain status. So the no-nos refer to those people who didn't have job strain at either time 3 years apart. And the yes box at the right-hand side, the blue box, shows that the ambulatory blood pressures of people who had repeated exposure to job strain is 11 millimeters higher than the people who did not have job strain. Next slide, please. Next. So we have roughly 50% or 60% of the population, working population in the United States with high blood pressure. A substantial proportion of those people will go on to have cardiovascular disease. And what is the cost of all of this to our society? We have an enormous burden of disease. Jeff Pfeffer and his colleagues at both Stanford and Harvard examined, in a book called Dying for a Paycheck, these same risk factors that I've been describing to you. And they found that almost 120,000 deaths per year could be attributed to these psychosocial stressors. Now, we talk about deaths at the workplace due to injury as numbering roughly 5,000. And we know we're doing a better job preventing injury deaths, but we're not doing anything to prevent deaths from psychosocial stressors contributing to all of these serious health outcomes. And the cost of this economically is enormous. In a budget now that's $4 trillion a year for healthcare, partly because of COVID, but also because of the aging of the population, an enormous percentage of money, is attributed to cardiovascular disease, which still represents 30% of all the deaths in the United States. Next slide. Well, the good news is work stress can be prevented, which is why you're all here. You want to know how we can make the working conditions better for people? Next slide. So the classic stress intervention triangle, you probably have all seen this. Level 3, the responses to the stressor. The intervention is at the individual level, so that we already are dealing with people who are sick. You're giving them treatment and sometimes drugs. For blood pressure, it's usually drugs and maybe some dietary changes. And at the other level, at the other end of this, is prevent the stressor. But to prevent the stressor, we have to know what the stressor is and where it comes from. We need to know the causes to be able to prevent the stressor. So if we attribute, disease to individual behaviors, which is the standard medical model in American society, disease is due to the fact that we don't take good care of ourselves, we're obese, we drink too much, we smoke, etc. And we pretty much ignore what we call the upstream effects, the social variables of class and race and sex classification and working conditions. It's extraordinary to me that when we talk about health in America, we rarely talk about work as a cause of ill health. Next slide. So I'm working on a paper, Obstacles to Healthy Work. I don't have time today to go through all of these. I know I just have a few minutes left, David, and I'm trying to keep track of that. I just want to mention to you some major things that we all need to address if we're concerned about making work healthy and for preventing conditions at work. There are ideological conflicts over health and illness. The medical profession doesn't give much importance to working conditions. Not yet they don't give much importance, but they're starting to hear a lot from people about this. And then there are major economic barriers to addressing unhealthy working conditions. Businesses make money from companies being productive. Workers being productive means that they have to work hard. So we have to convince businesses that it's in their interest. Next slide. It's in their interest to have productive work, but not at the expense of the health of working people. And in fact, there's a lot of research being done by the Centers of Excellence and other groups that basically show that when people, and I know my co-speakers are going to talk, co-talkers are going to touch on this, that if we can keep people healthy and feeling well, they'll be even more productive than they are under current circumstances. Next slide, please. So what is healthy work? Well, it's next slide. It's work that doesn't have all of these horrible characteristics: danger, abuse, discrimination, overwork, freedom from being silenced, ability to thrive, opportunities to grow in the job. These are all things that we should be trying to achieve in terms of work. Next slide, please. Next. And I'm going to wrap up here with just 1 minute about Healthy Work Campaign, and I'll stop, David. Next slide. What is the Healthy Work Survey? So we have constructed a survey that helps us measure all these psychosocial stressors at work, drawing on the NIOSH Quality of Work Life Survey. Next slide, please. Next. So we measure all of these main things we've been talking about: demands, control, rewards, precarious employment. Next slide. Different kinds of support, left balance, emotional labor, workplace injustice. Next slide. Next slide. I think you're getting the drift of what's being covered. If you want to use our survey, which is free, a product of the nonprofit Center for Social Epidemiology, which I helped create some 35 years ago, you can request that survey from us, on our website at healthywork.org, and you can use it with your employees to determine what psychosocial stressors you're dealing with. And I'll stop here. Thank you very much.
Thank you so much, Dr. Schnall. As a reminder, if you have questions based on that presentation, please put them in the Q&A section of the Zoom toolbar. Now it is my honor to introduce our next speaker. Keep losing my Zoom toolbar, so just pardon me as I navigate here. So next up, we have Kirsten Ambrose. And I also want to say before I introduce Kirsten, we will share some links in the follow-up email as well. So both Peter's presentation as well as a link to the Healthy Work survey is something that we will share with you. So don't worry about having to research and find that right now. Kirsten Ambrose. Kirsten is the Associate Director for the Osteoarthritis Action Alliance, located in the Thurston Arthritis Research Center at the University of North Carolina at Chapel Hill. She has a Master's of Science in Exercise Science and more than 20 years of experience managing multidisciplinary teams towards successful research successful research in chronic pain-related disorders and public health action for osteoarthritis awareness and education. She is especially interested in expanding delivery of evidence-based solutions with an emphasis on physical activity education and programming to improve self-management of osteoarthritis, chronic pain, and related conditions. Kirsten is a regular presenter for the Osteoarthritis Action Alliance at local and national professional meetings, and she has published numerous peer-reviewed papers, patient advocacy articles, and book chapters on arthritis and chronic pain. Kirsten, thank you for joining us today. We know that it's important to continue to talk about OA and osteoarthritis as part of this conversation, so I'll turn it over to you.
Absolutely. Thank you, David, and thank you for the invitation. I'm very happy to be here. We'll share a little bit about myself following David's lead on a descriptive introduction, since not all of you are on camera or able to see me. I am a white woman with shoulder length, curly, dark brown hair, wearing glasses, and shout out from North Carolina to all the rest of you North Carolinians. We are based here. I have a sweater on that's a little lighter than Carolina blue, for those of you who know. So to kind of take what Peter started off with, I think is a really great segue into what I'll talk about that gets a little bit more in depth into osteoarthritis. He, of course, teed up very nicely some of the issues around chronic conditions in the workplace with a focus on cardiovascular disease, burnout and depression, high blood pressure. These are things that also happen for people who have osteoarthritis. And that's a key thing to start there with my presentation today. We'll just get into a little bit about the prevalence of osteoarthritis and why we care, why it matters. And then I'll tell you a little bit about who we are and what we've got on the table. So before I get into that slide, I'll tell you about that in just a second. But osteoarthritis is common. It's incredibly prevalent, and it can be very debilitating. We know that in the general population, there are about 53 million people who have arthritis of any type, and that includes rheumatoid, psoriatic, gout, osteoarthritis, many, almost more than 100 different types of rheumatic conditions. Of those 53 million, over 32 million people have osteoarthritis. So it's incredibly common, the most common form of arthritis, and probably the least talked about. There is no cure. Many people with arthritis think that it is an inevitable part of aging, which it is not. Many people don't know or aren't sure what they can do to help themselves, but there are many things outside of clinical care because there is no cure, and the drug treatments and surgical treatments are expensive, invasive, and don't always solve the problem. And the problem typically with osteoarthritis is joint pain, joint stiffness, loss of mobility, loss of quality of life that goes along with that. Lots of joint crackling, a lot of these things that contribute to an overall picture of physical challenge to people. And this becomes a problem in the workspace. So we also know that more than half of adults who have osteoarthritis are of what we call working age. This is a CDC statistic that they define working age as 18 to 64 years of age. We know that many people work well beyond the age of 64. We also know that osteoarthritis is not a disease limited to older adults. Many, many younger adults are developing osteoarthritis due to risks from an injury in their teenage years from playing sports, or just from a motor vehicle accident injury, a fall, a work-related injury in their younger adult years. Inside of 10 years can start to show signs of osteoarthritis. Obesity is also a risk for developing osteoarthritis with increased joint loading. Repetitive movements that can happen in a workspace on an assembly line, moving inventory, those kinds of things can be very impactful. Military engagement, carrying heavy loads as a service person, jumping out of planes, all of these things contribute to the development of osteoarthritis that in turn impacts somebody's life from there on. So one of the things that we know about osteoarthritis, the impact in the workplace is one of the things that we address. So switching very briefly to tell you a little bit about the Osteoarthritis Action Alliance. We are a national coalition that is, our home base is at the University of North Carolina in Chapel Hill, but we service people all over the country who have osteoarthritis as well as their caregivers. We also have focus efforts on healthcare providers, healthcare systems, employers, and their employees also overlap with the general adult population, community-based organizations who are in a position to provide education and programs for people with osteoarthritis. So our outreach is broad, and one of the things we focus on as a coalition, we focus on those public health strategies that can be done outside of and or in conjunction with clinical care, things like injury prevention, weight management. Those are two factors that can help with the prevention of osteoarthritis. In addition to those two things, we also know that physical activity and self-management education are effective for managing osteoarthritis once someone already has the disease. So what we do is provide tools and resources as well as access to evidence-based programs to help all of these people who have arthritis, help employers and employees. And now to this slide, this is an infographic that describes our OA Care Tools toolkit. It is a free online toolkit that this slide kind of describes in a snapshot what is in the toolkit, why it matters. We see that osteoarthritis is common over there on the left. We've got a whole bunch of different educational tools and resources, many of which can be downloaded, printed, shared, posted in a workspace, intended to be used and consumed in service of helping people manage osteoarthritis, focusing on physical activity strategies. If somebody is not active now, how can they become active? We all know by now we should be physically active, but what are the steps to get started? What can employers do to help their employees? Things like that. So over there in the lower right, you see employers, or kind of in the middle lower right, employers. We have resources on the impact in the workplace, sort of the prevalence, the why we care, treatment strategies that are common for osteoarthritis, and also give an employer a sense of, okay, here are the conservative treatments, the things that we do, physical activity, managing a healthy weight, on down to the more invasive and more expensive strategies, ending with surgery, sort of the end stage disease option that we try to have people avoid surgical intervention for OA. It's incredibly expensive for the person. It's expensive for the employers. It is not always the best solution for people. Physical activity rehabilitation can often do as good a job as surgery. So all of these tools and resources you can find in the lower left is the website that we'll share after the fact, oacaretools.org. You'll see we've got information in there for healthcare providers, for employers, for adults and employees, and just general learning modules. So that gives you a sense of tools and resources you can take away. Next slide, please. I'll give you a little deep dive just very quickly. These are 3 of the resources we put together for the employer or in the employee space. A handout that you can download and post, how arthritis impacts your workers. video on osteoarthritis signs and symptoms in the workplace, and then a postcard or something that could be posted in a break room or sent around to people, depending on your workplace, on signs and symptoms in the workplace. So we try to develop a variety of tools and resources to meet different learning styles, different needs in different workplaces, to help educate the HR professionals who are and the leadership professionals in a business that are in the position to purchase benefits for their employees, or to engage in wellness programs, offer wellness incentives for employees, as well as the employees themselves. We know that people may not always talk about having joint pain in the workplace, not wanting to out themselves if they think it will have a negative impact on their ability to work. And even if they do, whether somebody has an active job or a passive sitting job, osteoarthritis can have a negative impact. Mental health issues come up when someone has chronic pain and so forth. We also know that the issues that Peter spoke about, cardiovascular disease, hypertension, all of those things, diabetes, obesity, all of these benefit from physical activity. But if we're not addressing joint pain and someone isn't physically active because their joints hurt, then we don't get anywhere with addressing their collection of chronic conditions. So it's really important that we pay attention to osteoarthritis. Next slide. The last thing I'll share with you briefly is that one of the other things we do, in addition to our OA care tools, is we are promoters and supporters of evidence-based programs for osteoarthritis, programs that we know, physical activity programs, self-management education programs, that we have shown in research, or other groups besides us have shown that these are effective in helping people manage their arthritis symptoms. We promote all of the programs. They live on our website, many different programs to choose from. We champion the Walk with Ease program, which is an Arthritis Foundation program, but we've developed a portal for helping participants to sign up, register for the program. It's free. We have a portal through the OA Action Alliance. We can also work with employers to buy into this portal and brand their own portal. So if somebody from your workspace, say, I don't know, I'll just pick like GE, you could have a GE branded Walk with Ease portal and offer the program, which is a very low cost program that gets people to learn and become comfortable with walking safely and to benefit their arthritis, which then helps with their productivity and their overall sense of well-being. Very simple program. We would love to work with you if you are interested and have a space to offer these kinds of tools and resources. By all means, reach out, check us out, take and use what you want. It's all free. Thank you very much.
Thank you, Kirsten. Such great resources being shared today. And as a reminder, we will share these resources in the follow-up. I want to introduce our third speaker, Steve Halterman. Steve is the statewide workforce wellness manager for the state of Colorado. And in that role, he has developed innovative and evidence-based health management programs for the workplace. He is a master certified health education specialist, an MCHES, a certified health employee benefit specialist, and a registered health coach. And before his time at the state of Colorado, Steve served as a behavioral health clinician, a health educator, and an employee benefits consultant. So throughout his career, Steve has helped primary care clinics, healthcare systems, and employers develop and manage various population health improvement programs. Steve, you're a frequent guest on our speaking unit, so thank you for joining us again today. Tell us a little bit about Colorado State of Health program, the program itself, why it's of interest, and how it's been going in the next few minutes before we get to Q&A.
Yeah, sure. And thanks again for having me back, David. Always enjoy participating in these events are great. A lot of great quality content on what employers can do to better manage their employees' health. And so that's what we are doing at the state of Colorado. Colorado State of Health is our evidence-based program to help our employees at the state to really look at their health risks and the chronic conditions that they have or may be at risk for, and to start to do something about it. Peter had shared about these three key areas about cardiovascular disease, hypertension or high blood pressure, and then burnout and depression. And those are not unique. These are the problems that we all have, that every workforce has. And the challenge is how to manage them. Peter also talked about the lifestyle factors, and Kirsten as well. Really, when you have or you're at risk for any of these chronic conditions, if you exercise a little more, eat a little better, get a little more sleep, focus on developing or improving some coping skills for stress and depression, and get to the doctor every once in a while, then you're going to be in a much better position to manage these conditions. And that's what we do at Colorado State of Health. We've been able to work with our provider partners through our Cigna Health Plan. We work with Everside, and Everside provides the primary care for our employees. So we've been able to work closely with Everside to integrate what we're doing with workforce programs through health coaching. And similarly, we have a population with Kaiser, and Kaiser has also done an amazing job where we work with the providers there, and then we have a team of health coaches. And the providers and the health coaches collaborate to help each employee who participates in this program, to help them to work together to connect the treatment plans the primary care physician has with the goals and objectives that the employee and their health coach work out together. And this is a combination that is unique. It was not easy for us to implement these programs, but once we have implemented them, we see the results, and our leadership recognizes that, and we've been able to put resources into helping more and more employees to do this. So we have over 5,000 of our 30-some thousand eligible employees enrolled in the program now. We have different pathways in the program. What I was just sharing about the clinically integrated portion, that's really a pathway for, we call it the intensive pathway. And that, that has a lot of engagement with the health coaches, really a year-long structure with really helping each employee to sit down and look at their needs, their health needs, their goals, put together a plan, and to execute that plan and continue that plan so that it can be sustainable throughout that first year and then beyond. We have two other pathways. The next one is the supportive pathway, and that's really for our employees who don't have access to those integrated physicians. So they're going to be working primarily with their health coach. And then we have a self-directed pathway. The self-directed would be primarily for those who don't have chronic conditions or are at low risk for chronic conditions. We do know that eventually most of us will have chronic conditions unless we start early to really take some steps toward preventing those chronic conditions. So we do have a number of employees who haven't yet reached that level, and we do hope to help them to really prevent those situations from happening. But we also have a lot of employees, and this is common throughout the workplace, throughout society, that who have the chronic conditions. They absolutely need the program, but for one reason or another, there are barriers in their lives that are preventing them from engaging in the program. And those are the employees that we really want to help to say, hey, this program is here for you. The state wants you to participate. We want to give you time to engage in the program, to go to your skill groups, to work with your health coach, to get to your doctor, and really take the time to manage your health so that you can have a better life. And for the state, that means you're going to be an employee who has fewer unscheduled absences. And also for you, it's going to give you more career opportunities. So really, it's a win-win across the board. We're very pleased with the way the program has gone, the acceptance of the program. Actually, immediately following this presentation, I'll be presenting to our supervisors about how they can support their employees who participate in this program. And that's a frontline element there. When an employee joins the State of Health, they go to their supervisor and say, hey, I just joined State of Health. And basically two things can happen. I mean, a variety of things can happen, but either that supervisor, and this happened a lot early in the program, can say, well, what is State of Health? And I don't know, you got to work. Or that supervisor could say, I'm so happy that you joined the State of Health. How can I support you in helping you to be successful in that program? And that's where we're going to be successful, because that's where it has to happen. We can put in all kinds of programs, but if we don't work at every level throughout the organization to help support those employees, then it's going to be difficult for them to make those changes, because those are not easy changes to make. Exercise more, eat better, develop better coping skills, get better sleep, get to the doctor. That's a complete change in lifestyle. And some people are ready for it. Some people want to do that, but there are barriers that are preventing them from doing it. And our program is really aimed at helping them to identify those areas in their lives that have prevented them from making these lasting changes, and to help them develop a plan and a strategy. And hopefully the state will be in a position to help them to do that. So that's in a nutshell what State of Health is. We're rolling out a new enrollment cycle 3 times a year. We have employees enroll in the program. So we just went out and we went out and visited some employees in their homes and filmed them sharing their testimonial about the program. And you can go see these. They're almost up on our website. It's coloradostateofhealth.com. Okay. Not gov. It can be .org, either or, .com, .org, but it's Colorado State of Health. And that talks about the program. And we're going to have these videos, really, really compelling stories from these employees who completed the first year of the program, and they're continuing, and they're making all these changes and seeing the changes in their lives. And so that's really what helps us to keep building the program. And we just want to help as many of our employees to get engaged as possible.
Thanks so much, Steve. You answered a few of the questions that had come up in your presentation. We want to dedicate the next 7 or 8 minutes to some of the questions that have come up. You talked about supervisor support. We know that managers and supervisors are really important individuals to help support people with chronic health conditions. Kirsten, if you want to come back to respond to any questions, that's great too. Peter, have you worked at all with supervisors and leaders in your work? And do you have any suggestions for how supervisors can help support individuals that may have disclosed that they have a health condition?
Well, the Centers of Excellence have done research on supervisors, and some of my research, which was not intended for intervention purposes, confirm what I think we know, that is that supervisors are extremely important links in the chain, and that having supportive supervisors who are open to communication with workers is extremely helpful in producing any sort of improvement. Of course, supervisors, and I say this hesitantly because I don't want people to take this wrong, are in a very awkward position between top management and the workforce. They oftentimes don't have enough authority to effectively make changes that seem self-evident to workers about what needs to be done in the workplace. So oftentimes I think there's a need for collaborative effort between workers and middle-level management in terms of trying to bring issues to the attention of senior management who, have other goals in mind. They're not necessarily the same ones as the middle managers and the workers have.
Yeah, completely agree. We talk about this all the time, that oftentimes organizational values around health and well-being are set at the top executive level of an organization. The individuals that are workers really want access to these core values, to the benefits, and it's really this middle manager supervisor category of employees that can be real facilitators for people participating in the programs. As Steve mentioned, communicating in a way that's enthusiastic and supportive. Thank you so much for telling me that you're participating in this. I want to support you. What can I do as your supervisor to support you? But they can also be, barriers or gatekeepers to someone participating, who may bring it to their attention and say, well, we have these deadlines, we have things we need to meet, and we may need to see if it works with your schedule, right? That sort of reaction from middle managers and supervisors is really a critical component to getting people to participate. Steve, there's been a couple just structural questions about the program. The lifestyle coaches at State of Health, are they employed by the state of Colorado? Are they state of Colorado employees, or are they employed by some of these other partners that you have?
Yeah, great question. So we've assembled a team of amazing health coaches. We have 13 total right now, and they are actually, they work for Kaiser or Cigna or Everside, but we're all one team. We have our weekly training sessions. We work together. We all deliver the program together, but they do work for those organizations, which makes it a lot easier for the state in that they're not employees on our payroll. It also has a lot to do with how we can finance the program. There are special provisions within the AMA has set aside these billing codes that if a health coach is a board certified health coach or a CHES or an MCHES, then those fees can be billed through the plan. We've established that through Cigna, which allows us to really make the program more sustainable rather than making these payroll costs or fixed costs to the state.
Got it. And one other procedural question, can the employees only take the intensive pathway or the supportive pathway? Do they choose one or the other, or can they go back and forth?
Yeah, so we're all about inclusivity and choice at the state. So any employee who is eligible, but based on their health conditions and their willingness to participate, can participate in the intensive and the supportive. But everybody can participate, anyone, whether you have the chronic conditions or not, in the self-directed pathway. And it happens that way that some people should be in the intensive, but they're not ready to make that full commitment. So they go into the self-directed, and then they can change when they're ready. Hey, you know what? I probably should have taken that intensive pathway. That's terrific. And then they can just step on up. Or if somebody takes the intensive, conversely, and like, oh, this is way too much for me, then we can just move them into the self-directed. We just want every employee to be in that framework, have access to the tools, and be able to participate in something.
Great. Peter, we have a bit of a provocative question. I'm going to ask you to respond to it, which is, it comes, and a couple people have asked this as well, which is, hasn't work-related stress really been around since the Industrial Revolution? And in recent years, it's where we've been researching it. So the question is, do we think it's really gotten worse, or has it always been there and it's not been measured and measured and quantified in an earlier stage? You've been doing research in this field for quite some time. I'm just curious your thoughts about, has it always been there and we just know more about it now, or is it getting worse? I have my own thoughts on it, but I would love to hear.
Well, for without doubt, it's some of it's been there for 100 years. Okay. Right. And yes, we are, the last 50 years, we've started to pay attention to it. So we're more aware of it. One good example is long work hours. Okay. There were no limits on work hours until the Roosevelt administration. And, people work 60, 70 hours a week without any, everyone did. Now, a lot of people still do. And we've, the ILO has published a couple of papers. I was fortunate enough to be a participant in them on long work hours and their risk. The more hours overtime you work, the greater your risk is for cardiovascular disease. So many of these risk factors are fairly new in terms of measurement, but I don't think they're new to us in terms of comprehensibility. Okay. I didn't say to you, David, you asked me about how I thought supervisors were doing. In my research, supervisors have the worst stress, okay? And partly because they have two groups they're working with that they have no control over, okay? They're supervisors who tell them what to do, and then the workers who tell them, go, I got a union, go, don't bother me, okay? But it is true that some of these stressors are conceptual, but here's what I think they all have in common. They all are trying to describe working conditions where people are being asked to do more than they're capable of doing, or they've been given the resources for doing. Okay, and I think that's common to many of these psychosocial stressors, whether we're talking about effort reward imbalance, or we're talking about demands and control, or even long work hours, which seems to be a kind of singular kind of variable. But what's going on when people have to work all these hours? They lose control. They get fatigued. So I think two things are happening. We're recognizing these problems, but working conditions for many people are getting worse. Okay, precarious labor involving 40 million or so American workers with no contracts, their jobs, their jobs are worse than what we've had before. And so on it goes. And whoever wants to ask me this, I could go through all of these variables and tell you which ones are better and which ones are worse. Not all of them are worse. Okay.
Thank you, Peter. I want to thank Kirsten Ambrose, Steve Halterman, and Dr. Peter Schnall for joining us today for this important dialogue. And all of you that have participated in the HealthLinks webinar series over the course of 2023. It's just been remarkable to see you joining us from all over the country, from so many other countries internationally. We are putting the link to the survey in the chat now, so you can access it there. It should also pop up for you, those of you that are on a computer as you exit today's meeting. It should generate for you. And also know that we are going to send it in the follow-up survey. We get so many emails from you making sure that you get the link to the survey, and we want to make sure that you can access it. So we will get the feedback survey over to you. We know it's important for your continuing education credits. I hope everyone has a happy and a safe holiday season, whichever holidays you participate in. One of the things we've been working on a lot recently is what does a recovery-friendly workplace look like? And I want all of you to encourage to think about how you're going to use alcohol or not for holiday celebrations around the workplace. I know this is a time of year where we celebrate, and oftentimes alcohol is included in those celebrations for a variety of reasons. Just remember that there's a number of individuals in recovery, and providing non-alcoholic options around the holiday season is a really key component of an overall diversity, equity, and inclusion strategy. So I just wanted to mention that as we approach the holiday season. So thanks again to our speakers and to all of our participants for joining us today and throughout the entire year. Stay tuned for our 2024 calendar. We're building it out. We're going to have some terrific speakers and presentations in 2024 as well. So thank you. Take care.